Hello, and welcome to Community Voices, where we talk to Humboldt County's movers and shakers. Today's guest, Dr. Ian Hoffman, County Health Officer of Humboldt County. And now here's your host, Paul Bressoud.
Hello and welcome to Access Humboldt's Community Voices. My name is Paul Bressoud and I'll be your host. Today we're speaking with Dr. Ian Hoffman from the Humboldt County Office of Health, and he is the Humboldt County Health Officer. And that is my first question, Dr. Hoffman. What indeed is a county health officer?
Well, great question, and thank you so much for having me. I'll be honest, I'm still learning exactly what a health officer is. I am new to this job, but it's, really, it's very different than a typical job as a physician. I'm a family doctor by training, and, I do have public health background, but, when I'm a family doc, I take care of panel of a few thousand patients, and you're dealing with their individual health issues. Maybe they have high blood pressure or depression, maybe they have diabetes. In this job, you're really taking care of the whole county. Everyone is our public health patient. And so and we're not dealing with the individual diseases like I just mentioned as a primary care doc. You're really dealing with the overarching circumstances of public health that affects everyone's life day to day. So how do those things in our environment interplay to affect the health of everyone in our community? So I like to say now I'm doctor to 135,000 people in Humboldt County, but in a different way.
Okay, well, let's go back. I got about 10 questions that immediately when you said that. First of all, does a person who is a county health officer have to be a doctor?
Yes, being a physician is one of the requirements for the job of health officer. And, the health officer position has historically always been a physician because of the nature of the job. There are certain regulatory roles that we play as a health officer that require physician level training. And I think also just that a physician's training lends itself to the job of health officer of navigating the various parts. Now, my job and a job of a health officer is certainly only one small part of the much, much bigger public health infrastructure which exists, which is run by many dozens of people across Humboldt County and really public health in general. We have a saying that everyone is public health, right? Every entity in healthcare, but also just across the whole spectrum of society is a part of the public health effort. And I think you're seeing that especially with COVID.
We'll get to, I'm sure you've talked enough about COVID in the last few months. I'm very interested in the job itself, the priorities that exist within the job. So you just said that you were the doctor to 135,000 Humboldt County patients, but that's in the public health sector. People might have private doctors, but you're looking at the demographics and health issues of 135,000 people. And then do you make decisions based upon the offerings of public health with that information?
Yeah, so, when we're talking about public health, we really look at 10 essentials of what is public health. And these are the things that inform us around public health decisions. So, they fall into three different categories. There's assessment, policy development, and assurance. And so those three areas sort of drive all public health decision making. And if we dial it down further, we look at, we're monitoring the health. So, that could be anything from measuring water quality of the waterways and the beaches, and that informs our decision making and policy making. Obviously, COVID's another great example of this, with monitoring the health of the population and really looking at how this affects everyone, not just individual patients. So we go on to diagnosing and investigating, which is a huge part of the COVID response. But when we talk about public health before COVID, communicable disease is a really big part of what we do. So we help manage outbreaks before COVID, things like tuberculosis or measles or syphilis, gonorrhea and chlamydia, a lot of the sexually transmitted infections. We have a sexually transmitted infection clinic here at the public health branch. We move on to how that assessment of disease leads to the policy and development. So we inform and we educate, we empower. We do a lot of discussion around these different diseases and what we're doing to monitor them. We mobilize, we work with community members to help them put things into place to improve the public health. We develop policies, so we work closely with policymakers at the local, the state, and the national level. And then we go to the assurance side. We enforce laws. So we work with law enforcement or other code enforcement to make sure things like restaurants are running properly, that we aren't having outbreaks of foodborne illnesses. We help people get linked to care that they might need. So a lot of that happens, especially in the maternal and child adolescent health unit, where we help people link to services. And then we give assurances that we're doing all this to improve the public health. And then we come back around and we evaluate. We see how does all this really work together to make sure that we are getting the best out of the public health.
Okay, I'm going to go back to assessment. People bring Dr. Hoffman the information about the county's overall general health, or maybe, as you said, what outbreaks are happening, what trends you're seeing. Is there a monthly meeting? Is there a form in which this information comes to you and you look at it and say, wow, we've got a rise in this, and then go ahead and mobilize your resources that way?
Yeah, absolutely. So there are statewide and national and even international monitoring systems for public health. Again, don't want to belabor COVID, but it's a great, way to kind of describe how this all happens, because it's happened on such a large scale. So, we have a whole unit, the communicable disease unit, which has many nurses and support staff who work in that unit who monitor diseases. So doctors diagnose them. There are certain diseases that are required by law to be reported to public health. Those go into a system that then feed into ours. We're monitoring that daily, not just for COVID, but for other things, like I mentioned, tuberculosis, syphilis, gonorrhea, chlamydia, a very long list of things. Those come to the nurses who start the investigation, and we meet on a regular basis. I mean, now we meet on a daily basis because of COVID. In other times we might meet on a weekly or biweekly basis to kind of go over the cases. But that's how it works. It's so the health officer really collaborates with all of those departments to help inform any medical decision making that might need to happen, and also go out and make policy. Obviously, the health officer has the ability to write orders, which we typically don't need to do very often, except for in the case of COVID, which has been kind of brought more attention to that aspect of the health officer job, is the ability to write law, really.
Okay, so that's almost like an executive order. As the county's health executive, you can go ahead and supersede existing practice and write an order that would be more for an emergency. Let me ask you this question. Yeah. Policy is slow, usually, in the history of government. But health responses, I would assume, over any aspect of government would have to be the fastest. How does that, and I know COVID would be an excellent example, but how does that work together when you've got to be someone that has to be responded almost immediately and move this giant structure that is government to support you?
Well, I think it's like on a lot of different levels. The pandemic response has been one that has really highlighted public health's role in emergency response. So there are other public health emergencies that might intersect with emergency response. So, in a fire situation, we might be very peripherally involved in helping support access to care, or patients who need medications or something like that. But we're not the primary response. In that's really the emergency office operations center who guides those responses. In a public health emergency like a pandemic, we are at the lead, working alongside with law enforcement and the emergency operations center to respond to the health side. So yeah, it's like, but when we meet the challenges that we're faced with, so just like if there were an earthquake or a tsunami or a massive wildfire, we have to mobilize quickly. We have all those in place for those kinds of responses. For something like tuberculosis outbreak or syphilis outbreak, we might not need to. We would act quickly, but we might not need to act so quickly. It's not such a large scale, so we can work with our nursing unit to figure out who needs to be isolated, who needs to go on quarantine, who is exposed to those diseases. And we might find along the way that there are policy measures that need to be implemented to try to address this. Maybe there are responses that would help reduce the impact on public health. Also, the educational piece. So, a great example right now is we're seeing a resurgence of syphilis in our community, and this is not just something that we see in Humboldt. This is happening across the state of California, across the whole West Coast. We're going to launch a public education campaign for our doctors and our medical community to really get the information out there about syphilis, so that we can try to keep this under control.
I have a couple questions from that response. First of all, how many units do you have working under you?
Yeah, it's a big organization. We're a small building, but we fill it well. We have the maternal child adolescent health unit, which really, and each of these units has multiple people working in multiple aspects, but that's really nursing home visits, working on programs for access to dental care, for making sure there's food, adequate housing. I mean, there's a whole host of things that go into it, and then just getting adequate medical services. There's environmental health, which is more of a regulatory and monitoring group, and they include things like land use, solid waste enforcement, consumer protections of going out and the folks who go out to the restaurants and monitor and make sure that the food that we eat is safe. And then hazardous materials. We have public health support services, which includes all of the background folks who help manage our budget and help do the analysis and just support all of us. We have the communicable disease unit, which I talked about quite a bit. And then there's a whole unit for healthy communities, which is initiatives around certain things that affect public health. So tobacco-free Humboldt, family violence prevention, alcohol, childhood lead poisoning. It goes on and on. We have it's a massive program, and I can tell you the people here are amazing. They're dedicated. Many of them have been at this for, a lot of the folks here have been doing this for 25, 30 years. It's their life dedication. Public health folks are really amazing group to work with. I feel really honored to be here.
Well, let's ask this question. Here we are in the middle of a pandemic. You've talked about all these units. These other health problems don't go away. How do you give the proper attention to these other health problems when there is the most enormous health problem since the 1918 influenza out there?
Yeah. Yeah, I mean, we have had to scale back. Obviously, we can't keep the full public health response going throughout the pandemic. Many people in those other branches of public health have had to be reassigned to COVID. But we're getting closer. We're starting to remobilize people back to their home offices. We're looking to, pick up where we left off. So, I think obviously the pandemic response was the most important thing. So we had to pull back. There was no choice, and we needed the manpower to make it happen. But I think that the critical programs that were absolutely necessary continued, and we pulled back where we could. So we're excited. I think, everyone in public health is ready to get back to the work of public health. So we're excited that it looks as if we're nearing the end of the tunnel with this pandemic, and we'll keep an eye on it. But we are excited to get back to public health work.
How much of your job is prioritizing? And you're laughing. Like, why are you laughing?
It's all about prioritizing. Yeah.
So
yeah, I mean,
that's tough when you're talking about health, and when it may be somebody's health. If you prioritize something else, somebody is going to be upset.
Yeah, but it's part of what we have to do. I mean, we have to do that in medicine in general. I mean, I think, again, that's one of the reasons that being a physician it really lends itself to this job as a health officer. You have to pick and choose what is the most important, what's going to affect health the most. And luckily, I don't have to do it all myself. There's a huge team here to help make those decisions with me, and put those things in motion. And again, falling back to COVID, I think this was a great example of how public health had to make that decision to prioritize COVID over everything else. We had to drop everything to deal with COVID, but everyone recognized, this was a pandemic in the making, and we had to get strong, quick, effective response. Humboldt, under Dr. Frankovich, was one of the first counties to put a mask mandate into effect, and I think that has really shown that that sort of quick action reflected what happened later in the pandemic, where we haven't had the cases like we've seen across the rest of the state.
Well, let's talk about the state for a second. Now, do you go to state, county health officer trainings, or is there a group that is connected with the over 50 health officers? You're part of a very small group that talk to each other during this time?
Oh yeah, we, I don't know what the cadence of the meetings is like in normal times, but right now, pretty much every day I'm having a meeting with the state, where there's other health officers, other health executives, counterparts like Director Stevens, yeah, so it's a great group, over 60 actually, jurisdictions across the state, health jurisdictions. So we're in close communications. There are multiple groups who work with health officers, organizations, the CCLHO, HOAC, CDPH is probably, that's the California Department of Public Health, is the overarching, public health department who we all interact with very closely. But there's a lot of support. I'm grateful to have their support. So we talk, like I said, daily. We have meetings where there's a lot of back and forth between the different counties and what's going on in one county, how we inform the state on their decisions. So it's a very collaborative process.
I asked this question because I don't think there's a state in the union that has more diverse counties. How in the world can the interests of somebody, say, from Los Angeles County or San Diego County or, the populated counties up north, Santa Clara County, how could they have anything in common with what you're facing in Humboldt County, or you have anything in common with what they're facing?
Well, yeah, I think there are definitely commonalities, obviously, but there are differences, and so we recognize those. I think the state has tried to take regional approaches as well. So, we're part of the coalition of northern local health jurisdictions. It's called Rancho, and that group meets also weekly to kind of discuss the Northern California health officer issues. And yeah, we've recognized, and CDPH meets with us on those calls as well to discuss what are the specific issues to public health here in Northern California. I mean, currently we're talking about COVID, so for, a good example here is, the vaccine rollout. What needs to happen in Los Angeles is not what needs to happen here. We have a lot different needs to get into rural communities that might be hours away from population centers that are on difficult roads. How are we meeting those challenges? They're rolling out this statewide program called My Turn, which requires internet access, use of a bunch of devices. And here we are in Humboldt County trying to reach out to people who, many of whom have no internet access, who, even in the places we're holding mass vaccination clinics, there's no service for us to have internet access. So, we work together to meet those challenges, and the state definitely recognizes that there's no one size fits all. It's a collaborative process. There are certain commonalities that have to be applied across the whole state, but there are regional and local differences that need to be addressed too.
I have a specific question to that. With older populations getting the vaccine first, they might not be the most internet savvy. How is it hard to get those folks participating?
Well, again, we have an incredible team. I can't take credit for any of this. The Joint Information Center has been at this COVID response since the very beginning. In fact, they just had their 1-year anniversary of taking phone calls. So they have mobilized and said, hey, anyone who needs a vaccine appointment, who's in those tiers that are open, especially the older population, if they have inability to sign up on our interest list online because they don't have internet access or they can't navigate the form, we will fill that out for them on the phone. The same with appointment scheduling, because obviously now today's modern world, it's all very online. So even once those people have been offered an appointment, say off the interest list that we have, they have to go online to book their appointment, to put all of their information in. That can be done for you over the phone with our Joint Information Center. So we've managed to now fully vaccinate 45% of our 75-year-old population, and it's over 70% who've had at least one vaccine. I think that's incredible, and I give full credit to the Joint Information Center, because they made that happen and all of our partners who are vaccinating, but really making sure those people who are the most vulnerable in our population, who don't have internet access, who didn't have access to a doctor that was vaccinating, they made hundreds and hundreds of calls to people to get them into appointments, and it's been a true testament to this community.
Being a small county with a population of only 135,000, do you have greater leeway in which you can go ahead and implement some of these state guidelines?
I think it does benefit us in some ways. I came into the community not knowing a lot of people here, but Dr. Frankovich and her predecessors had all made very good inroads to, the schools, the business sector, I mean, just across the board, county government, obviously Board of Supervisors we work really closely with. So I think that being a small county allows us to work more closely together than there's just so many players in a larger jurisdiction, urban area. So I do think it's helpful. I think we can get a lot done because of that.
With the vaccine rollout, do you find there are different groups clamoring to call themselves essential and want to go to the next tier and be ready to get vaccinated?
Yeah, I mean, we don't fault anyone for wanting the vaccine. I think we want to give the vaccine out as much as anyone else. And, I think it's really important to recognize that there are a lot of people who still need the vaccine and are waiting. So we've tried to balance that really with, trying to get the most vulnerable in, those who, based on their age, have been at the highest risk, with also balancing the population at large and really getting society back to functioning. Those two competing challenges have really guided us in how we roll out the vaccine. So, for instance, I think Humboldt County, very strong education bent. We wanted our kids to get back to school, so we wanted to get those teachers and educators and folks who support education vaccinated, while also balancing those who are vulnerable. So it's been a difficult pull, but we've managed to, I think, do really well in balancing those two competing priorities. There's always going to be somebody who isn't happy at the end of the day.
I assume that. We're going to have you on again sometime, because we're going to have to talk eventually about the post COVID world. And I would assume mental health issues also fall into the public health perspective. And who knows what it's going to be like for any of us when this all ends. I thank you greatly for taking the time out of what must be a busy schedule. I would imagine after the pandemic thankfully leaves us, your job will seem more manageable in many ways. So I want to thank Dr. Ian Hoffman for being here and for joining us. And we'll see you next time on Community Voices. Thank you, Ian.
Thank you so much. Great to be here.
This has been Community Voices with your host, Paul Bressoud. Thank you for joining us. If you represent a nonprofit organization and are interested in being a guest on Community Voices, send an email to info@accesshumboldt.net or call 476-1798. Access Humboldt, local voices through community media.